viewers, in this video we are going to discuss about part 3 regarding leukemia. Okay, especially we are discussed about clinical manifestations. Okay, clinical manifestations of leukemia. What are the clinical manifestations is there means in that first one we are identified one symptom, major symptom, that is the anemia. Why? Because what is mean by anemia? Loss of hemoglobin in the body, okay, especially in the blood. Okay, why? Where it is present means in the blood. Where it is formed means from the bone marrow. Okay, here what happens means in the leukemia disease condition, bone marrow gets some type of cancer. Okay, the bone marrow not producing any WBC, RBC, blood platelets. Okay, that's why the children may be affected or showing one symptom like anemia. Okay, next another that is the infection. All over the body parts having the some infection. Why? Because the blood circulates all body parts, no? That's why the children's having the infection. Why? Because once the body, when the which part means one bone marrow, that is the humerus bone marrow, or the long bone, that is the tumorous or femur bone marrow. Which bone marrow will be affected by this type of cancer means that may be easily spread to the all over the body parts. Why? Because the blood will be circulate all body parts. Okay, next another symptom like complete bleeding. Okay, the children are having the excessive bleeding from the body parts. Okay, the children are having the sometimes of fever. Why? Because the blood having the control or maintenance of body temperature or regulates the body temperature. Here the blood not there in the body means the body temperature not regulated, not maintained. That's why the children's body temperature should be raised. Okay, this is the one reason. Another one is that the children are having the fatigue. Oh, why? Because they are doing one work means the energy. Okay, their energy will be less. Why? Because in the blood weak. Okay, there is no normal blood percentage. That's why they are having the one symptom like fatigue. Another symptoms they are having the leg pains. Okay, especially in the joint pain. Why? Because the bone marrow will be there in the joints and bones, no? That's why the children are having the joint pain or bone pain. Okay. Next another one is the abdominal pain. The children are having the pain in the abdomen. Okay. Next lymph node enlargement. Okay, in the body lymph nodes is there, no? In that lymph nodes they are having the enlargement. Their size, their structure will be increased. Okay, next another symptom like hepatosplenomegaly. Okay, the liver will be enlarged, the spleen will be enlarged. Their structure, their function will be abnormal. Okay, next another one is the increased ICP, intracranial pressure also increased. Why? Because the leukemia will be affected to the meningitis, no? Okay, once the meninges layer will be get some infection due to the virus or bacteria, the children may have the increased ICP. Okay, due to that reasons the children are having the some headache in their body and the children are having the vomiting. Okay, headache and vomitings, these are the common symptoms. If the children are affected this lymphatic meningitis leukemia. Okay, or leukemic meningitis. Okay, this is the reason. And another symptoms like the children are having the common symptoms malaise and pain. Okay, this is regarding clinical manifestations of leukemia. Okay, next we are going to discuss about diagnosis. What is the diagnostic procedure? How we are identified the children especially suffering with the leukemia. Okay, in this first step, that is the history collection, we have to collect history from the children. Okay, what is the problem? Okay, for example, the children are having any bleeding from the nose or any anemia means loss of blood, or the children are having the any papilledema means edema formation is there, no? Or the children are having a fever or malaise or dyspnea, difficulty in breathing, or the children are having any pain, okay, abdominal pain or joint pains or leg pain. Okay, these symptoms we are identified by doing the history collection and physical examination of the children. Okay, in this physical examination and history collection, we are decided 50% of children's disease condition. Okay, next we are doing some examinations like blood examination. Why? Because this is cancer especially to the blood cells, no? WBCs and RBCs, red blood cells and white blood cells maybe get some cancer, means that will be identified by doing the blood examination only. Okay, by external examination we are not decided complete disease condition of children. Okay, when we are take out some samples from the internal body organs, then only we are decided which of the disease condition of children. Okay, next in that blood examination we have to do the complete blood count. Okay, what is the blood percentage? Hemoglobin percentage normal or abnormal? Compulsory the blood percentage should be decreased. Why? Because the bone marrow having some type of cancer, no? The bone marrow not producing new WBCs, new RBCs. That's why the children shows anemic condition and low hemoglobin percentage. Okay, next another diagnosis like chest X-ray. Okay, the infection may be spreading to the lungs or some type of organs. Okay, that will be, for example, hepatomegaly is there, or splenomegaly is there, or in the brain, especially meningeus layer, or in the brain cerebrum, cerebellum, which part will be affected by this cancer, that will be identified by doing the X-ray only. Okay, next another one is the lumbar puncture. Okay, it will be lumbar puncture, nothing but in the spinal cord, lumbar bones is there, no? Okay, thoracic bones, lumbar bones, coccygeal, sacral bones is there, no? In the especially L3, L4 level. Okay, L3, L4 level in the lumbar bones. Okay, third bone and fourth bone, in between that we have to collect some sample for identification of infection is spreading to the brain or spinal cord. Okay, in that by doing lumbar puncture we have to collect a sample of cerebrospinal fluid. Okay, cerebrospinal fluid is protecting fluid that organs like cerebrum and spinal cord. Okay, the infection is there in the cerebrum or spinal cord or brain and spinal cord, that will be easily identified by doing the cerebrospinal fluid examination. Okay, that's why we have to do in this disease condition lumbar puncture. Okay, next these are the examinations regarding leukemia disease condition, if the children will be affected by this leukemia. Okay, next we are going to discuss about management for the leukemia. Okay, what is management? In that management mainly three management is there, no? Medical management, surgical management, nursing management. In that first step, that is the medical management, what are the medicines we are provided or we are administered for the children if the children are suffering with the leukemia. Especially in this leukemia disease condition, we have to administer that medications like chemotherapy. Okay, this is the best treatment for the cancer of blood cells. Okay, next another one is the bone marrow transplantation. Why? Because the bone marrow will be getting some infection, the bone marrow having some excessive growth, the bone marrow having cancer, means okay, the infected bone marrow will be removed and healthy bone marrow should be transfused or transplanted to the patients, especially in the children. Okay, next another one is the blood transfusion. If the children are having a low blood percentage, means for reducing or for control of anemic disease condition, okay, we have to transfuse the blood to the children. Okay, for reformation or for new growth of the RBCs. Okay, by doing this bone marrow transplantation and blood transfusion. Okay, these are the major treatment for leukemia disease condition. Okay, next another one is the nursing management. As a nurse, what is our role? What is our care for children? Means in this first step we have to assess the children's complaints. Okay, the children are having any bleeding from the nose, or any difficulties in the breathing, or any pain is there, or any abdominal pain is there in the children, or what is the children's symptoms. Okay, some children are showing some edema formation or some pain. Okay, what is the symptom? Depending upon the symptomatic treatment we have to provide. Okay, next another one is the central nervous system symptoms is there. Okay, for example, increased ICP or headache, vomiting. Okay, these will be corrected by administration of symptomatic treatment. Okay, for example, vomitings is there, antiemetics. Okay, headache is there, or increased ICP is there. Okay, depending upon the symptoms we have to administer symptomatic treatment as prescribed by the physician. Okay, in the presence or in the prescription of physician only, physician order is there, then only we proceed for administration of medications. Okay, by own or by own idea we never give any medications to the children. Okay, next another one is we have to check vital signs. Why? Because the hypertension may be shows in these children. Okay, increased body temperature, or sometimes breathing pattern also increased, pulse rate also increased. Okay, these all will be controlled by checking what is the normal or what is the abnormality. Okay, why we have to maintain, how much we have to maintain. Okay, that will be identified by doing the checking of vital signs. Okay, next another one is the fluid balance. Especially we have to maintain the fluid balance by administration of oral or NS, okay, normal saline or linger lactate or DNS. Okay, for improving their health status, for prevention of dehydration, we have to administer the fluids to the children. Okay, next another one is the balanced diet we have to provide the children. Okay, why? Because by diet, okay, we are providing healthy diet only, then only the blood forming cells should be increased. Okay, for implementation of bone marrow, for healthiness of bone marrow, we have to provide balanced diet to the children. Okay, next another one is the we have to provide complete bed rest to the children. Okay, next another one is the emotional support. Okay, the children are having some emotions. As a nurse, we have to give some emotional support to the children and parents. Next another one is the diet. In the diet we have to give some health education, like small frequent of meals. Okay, the children encouraged to take small frequent of meals for control of vomitings or for improving their health status. Okay, next another one is the avoiding spicy foods. Okay, spicy food should be avoided, and acidic foods should be avoided who are suffering with this type of leukemia disease condition. Okay, next another one is the hygienic measures. Okay, the children are having any unhygienic practices, means that will be may cause improving infection. Okay, for control or for reducing their infection, we have to improve the hygienic care to the children. Okay, for example, in this especially we have to give that soft brush for brushing the or for improving their oral hygiene. Okay, next another one is the salt diet. Okay, the children are restricting salt diet, and the children are in this disease condition chemotherapy is major, no? Okay, for a control of leukemia disease condition, we have to give chemotherapy to the children. Okay, in this chemotherapy the children are using or maintaining this chemotherapy, means they are losing their hair. Okay, they are having some tension. Okay, why we are losing our hair, means due to the effects of chemotherapy. Regarding that, we have to give some health education to the children. Okay, before going to give chemotherapy to the children, we have to cut the short hair. Okay, we have to do short hair of the children. Okay, next another one is the in this health education to the parents for home care. Okay, many means prolonged period we have to give chemotherapy to the children. Why? Because in early stages we are not giving proper treatment, means that will be having chronic disease. Okay, blood formation in early stages not there, long time taken. Okay, that's why how to give care to the children in the home level. Regarding that, we have to give complete awareness, complete health education to the parents. Okay, next last step, that is the complication. What are the complications regarding this leukemia? Means first one is the infection. Hepatomegaly means liver size should be increased. Splenomegaly, spleen size should be increased. Next another one is the uncontrolled bleeding. Continuous the children are having bleeding. Okay, bleeding from nose. Epistaxis we are identified in the children. Okay, next another one is the CNS complications, like central nervous system complications. It means meningitis or tumor formation in the brain, especially cerebrum, cerebellum or spinal cord. Okay, or hemispheres of the cerebrum. Which part means once the body in the blood having a cancer, means that is the most dangerous to the children. Okay, this is the one type of dangerous disease condition to the children. In early stages we are providing a special treatment, that is the chemotherapy, means we are giving some type of prognosis. Okay, we are controlling complications, but we are not curing the disease condition. Okay, this is regarding leukemia disease condition for the children. Okay, thank you everyone.